Clinically Speaking is our advisor series of short videos featuring clinical updates from Vitality clinicians and experts in their fields.
Hi, my name is Athos Rashovich, and I'm the Distribution Director for Vitality Health. Welcome to Clinically Speaking. According to the NHS, around a third of adults in the United Kingdom have high blood pressure, which is also known as hypertension. If this condition goes untreated, it can lead to life-threatening illness, such as cardiovascular disease, which in turn can lead to heart attacks and strokes. These are some of the most common causes for private medical insurance claims. Concerningly, the majority of your clients with high blood pressure might not even know that they have it. There are, however, a number of warning signs that they can watch out for, and in this episode, we'll hear from Dr. Anushka Patchava, Vitality's Deputy Chief Medical Officer, and from Dr. Marshall Rovner, Global Medical Affairs Lead for AliveCor, a digital health tech firm which specializes in ECG technology. We'll find out about the causes of hypertension, how it can be prevented and treated, and the role that health insurance can play.
Hypertension is a term used to refer to high blood pressure. Often, people will go to their GP, they'll have a blood pressure monitor put on them, and they'll get a reading with two numbers, your diastolic and your systolic. If your numbers are higher than 140 over 90 milligrams of mercury, then you have hypertension or high blood pressure. There's a little bit more leeway, whereby if you're above the age of 80, your numbers could look like 150 over 90. Again, hypertension is a condition that refers to consistently high blood pressure. A one-off reading does not count as hypertension. The symptoms of high blood pressure or hypertension can vary. You might suffer blurriness, double vision. You might have chest pains or be out of breath. You might feel lightheaded or faint. You might also have fatigue and/or feel that you can't do the things you once were able to do. These all contribute to a plethora of symptoms that are attributed to high blood pressure or hypertension. If you consistently suffer from some of these symptoms, then please do see your GP in order to get your blood pressure monitored and tested. For some people, hypertension can be caused as a result of stress. So removing things that cause you high stress, either in the work or home environment, can help reduce that high blood pressure. For others, sleep and/or increasing the level of activity they do can also help reduce their high blood pressure. In some cases, high blood pressure is caused by a poor diet. Diets that are high in fat, in salt, and in cholesterol can lead to high blood pressure. So looking after what you eat and your nutrition will really help in terms of your blood pressure and reducing it. For others, it might be due to medical conditions they experience. For example, we know that kidney problems and hormone problems can increase your blood pressure, as can diabetes and high cholesterol, which may be familial.
What we would do is you'd have a blood pressure cuff, and naturally a physician, a nurse, whomever, maybe even a technician, obviously would collect that information probably in the office. Of course, people can do this at home as well. We're moving more towards personalized medicine, I believe, and in terms of technology, you have a variety of different brands out there. There's Omron. I believe Apple Watch has programs as well for monitoring blood pressure, I believe. And there have been some publications over the years that, in fact, do suggest that telemonitoring, for example, of one's blood pressure actually does have some benefits. So whether or not that monitoring of blood pressure at home by patients over the long haul is done by an old-fashioned analog device, such as a manual blood pressure cuff and a stethoscope, or perhaps a more modern digital device, you can see how if we're moving more towards a hospital at home or telemedicine, personalized digital devices that plug into cell phones and whatnot can definitely have some value here in terms of the evolution of care.
Having hypertension is quite a significant medical condition. If you leave this untreated or continue to have high stress or a poor diet or other factors causing your hypertension in your life, you put yourself at risk of suffering from a cardiac event. For example, you might suffer from a heart attack, which could in some instances be fatal or significant and severe. Therefore, we would advocate that members look after themselves and their health, regularly see their GP to monitor their blood pressure, and seek advice or prescriptions to help reduce their blood pressure when it is deemed that they have hypertension. Vitality can help clients who may be suffering from some of the signs and symptoms of hypertension in many different ways. Firstly, members have access to annual health screening, which will allow them to identify whether they have some of the causes we described in relation to hypertension. For example, your annual health screening will detect whether you have high cholesterol. Secondly, members who have some of the signs and symptoms we talked about, if they have headaches, palpitations, if they're struggling with breathing, can seek out and see a virtual GP or one of our face-to-face GPs. Through this, they can ascertain whether their signs and symptoms are in fact due to hypertension and receive blood pressure monitoring. In addition, Vitality work with several innovative digital health partners to bring benefits to members in addition to their health care insurance plans. For example, our members have access to digital self-help tools. Within that, you can access discounted blood pressure devices, which will enable you to monitor your blood pressure more closely at home. We also have a partnership with AliveCor that also enables cardiac monitoring remotely and in the home. In addition, our Vitality program rewards members who want to exercise more through activity points and also allows members to access benefits that encourage and empower them towards healthy living and healthy diet and nutrition.